cryopreserved amniotic membrane treats moderate to severe dry eye. There's a lot of clinical studies that have been done on this area, and I'm sure the biotissue team can supply you with these. There are a lot of clinical studies that have been done. Two that are referenced here in this slide. The first one is the Thomas John study that looked at 10 patients that had an improvement with Prokera maintained improvement for 3 months in corneal sensitivity and corneal and confocal microscopy and corneal sensitivity. And so again, it gets back to that, our understanding that the ocular surface, it can be improved if we have improved corneal nerve function. And in a later study of 97 eyes, 88% of these patients showed an improvement in PEK. And that's really our line in the sand, right? I mean, when we're taking care of our ocular surface disease patients, the litmus test for trying to figure out if what you're doing is helping this patient really objectively is that corneal PEK at the slit lamp. And so if you're showing an improvement over a 3-month period using this cryopreserved amniotic membrane, that's again a very meaningful thing to do, and just such a critical part in my clinic here at Minnesota Eye. And that's what I see in my practice. I see that my patients that might be referred to me with mild to moderate disease, if I'm doing the kind of our basic treatment package and they become refractory to that, I know that I can use the cryopreserved amniotic membrane in most cases and get their level of dryness to be improved by 1 level. And in some of those patients where we have significant compromise and a lot of systemic and ocular comorbidities, sometimes I go into it knowing that I may need to use this cryopreserved amniotic membrane in the same eye more than once. And again, this is an area where I've had some cases where it's a great synergy with ophthalmology, where I would show some improvement, and that might be a kind of a way to indicate to our surgical colleagues that this patient might do really well if we sew in amniotic membrane and do a torsorrhaphy. So I find cryopreserved amniotic membrane to be just so many applications. So when we have kind of this these patients that have that might be refractory to our initial offerings, I think thinking about regenerative medicine is an important thing to do and really should be the standard of care now in the year 2020.